CRISPR-made CAR-T cells may be the long-awaited solution against autoimmune diseases.
You will recall from our previous episodes that CAR-T cells are cytotoxic T lymphocytes, which have been programmed to recognize a specific antigen by installing a chimeric receptor.
In the past, we talked about how CAR-Ts are the scourge of cancer cells, and they are. Now, a group of researchers at the Naval Medical University in Shanghai have adapted the same concept to tackle autoimmune diseases.
Autoimmune diseases may have different causes, but they all result in dysfunctional activity of immune cells, particularly B cells, which turn against the host and start attacking it.
The idea behind this research is both clever and simple at the same time. Similar to treating a cancer like leukemia, when dealing with autoimmune diseases, getting rid of the bad B cells is the main issue.
And we already know that the programmed CAR-T cells can easily find and mess up B cells, so let's do the same but to treat an autoimmune disease.
The scientists decided to test this approach in one patient affected by immune-mediated necrotizing myopathy and two patients with diffuse cutaneous systemic sclerosis.
These two autoimmune diseases are some of the most severe out there. However, manufacturing CAR-T cells from the patient is lengthy and expensive.
As you can imagine, cells extracted from a patient may be harder to manipulate compared to healthy cells, and this sometimes even results in failure of the manufacturing process.
And that's why they decided instead to produce CAR-T cells from a healthy donor so that they could have a ready-to-use CAR-T product upon request. And to do that, they turned to CRISPR, of course.
As we told you in our Making the Cut series, CRISPR can be used to render the CAR-T cells universal, making them both inoffensive and invisible to the patient's immune system.
To do this, they simultaneously disrupted 4 different genes while also integrating via lentivirus designating CAR. That's a genetic equivalent of a triple backflip with a twist.
Following the infusion of these highly engineered CAR-Ts into patients, the number of pro-autoimmune B cells in their blood dropped to almost undetectable levels for almost 2 months, which was accompanied by improvement of the symptoms and, more importantly, the overall life quality of the 3 treated patients.
What is amazing is that up to 6 months after the treatment, the latest report reported the symptoms kept on improving or stabilized. Even if the B cell number returned to the original values, the autoimmune B cells were effectively gone.
This seems to indicate that this reset of the immune system was an effective treatment against autoimmune diseases. However, longer follow-up will tell us whether the treatment guarantees a final resolution of the condition or re-administration will be required.
If the long-term results are positive, this approach could revolutionize the treatment of autoimmune diseases and potentially give hope to almost the 5% of the human population that suffers from such diseases.
We here at With the CRISPR will follow closely this topic and will be happy to tell you all about it.